Are you ready to clear the air and reclaim your life? Join me, Dr. Kevin Smith, as we dive into the conversations that matter: health, happiness, purpose, and passion. From migraine breakthroughs to lifestyle transformations, we'll explore it all on Clearing the Air, a prescription for life. Hello, I'm Dr. Kevin Smith of Clearing the Air podcast, a prescription for life. And today I have a great guest, Harold Smith, who's a patient of mine. And we're going to have a great discussion about his ailments and how I helped him overcome those to live his best life.
Yeah, thank you for inviting me.
So when I saw you, I immediately said, I've got to talk to this guy.
Well, I had no idea what your intentions were. When you rolled the window down and said, "Sir, can I help you?" I said, "No, sir, I'm okay. I've got Parkinson's disease." And then your face lit up.
Yes, and you were wondering why.
And yeah, you said, "Can I speak to you for a minute?" So I walked over to the window, and you pulled out a card. You said, "I'm a doctor, and I'm doing research on Parkinson's and how it's associated with deviated septums." So he said, "Do you have a deviated septum?" And I said, "Well, I've been told that I do." And you really lit up again.
Because I'm putting the puzzles together. You know, nasal abnormalities, deviated septum, the number one abnormality that I find, along with other specific abnormalities that can cause headaches and migraines.
Yeah, right.
So when you told me that, I'm just seeing the puzzle pieces just come together. Oh, my goodness.
I've been having severe headaches for a long time.
Right.
So I thought that was just something that I was going to have to live with.
Mm-hmm. But I asked you to come in and get a screening scan. That's what I do. I offer screening scans to people who have these abnormalities or have these neurological problems.
So because of my desire to find healing in any path that I can, and having been praying for into the universe and putting it out there, I felt a connection. I thought, well, this is the answer. Somebody has sent him to me. So I came over to the office the following day.
Yep.
And you said you were surprised that I'd showed up so early. But when you live in the world of Parkinson's disease, it's very stressful. You're eager to find any hope at all because it's a brain issue where your dopamine levels are depleting, and it causes tremors because your body muscles don't function properly.
Yes.
So we did the scan.
We did the scan. Come on, let's get to it.
And then you got excited and came into the room and said, whoa, 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 whoa.
I didn't even have to sit down. I passed by the CT scan, the monitor, and just glanced at it. And lo and behold, horrible deviated septum, large turbinates, other things going on.
I had no idea it was as bad as it was until you told me.
That's right.
And then you showed me the images and explained to me in detail what was going on there. And, of course, you implied that I needed help.
Right. So
we set an appointment to have the procedure done.
Yes.
And it was just pain-free from the very get-go, quick, efficient. It was over with before I knew it. And I could breathe like I had never breathed in my life.
That was in the recovery room.
Yes.
Well, let me just tell everybody out there, it's a nasal sinus procedure that I did on Harold, along with trimming his uvula. I'm a big proponent of looking at the root cause and finding the root cause to problems. So in his case, he had a multitude of problems. He had the breathing issue.
Sleep apnea.
He had the sleep apnea, the snoring. He had the headaches, and he had the tremors. And the reason the tremors caught my attention is because I've had some migraine patients have tremors as part of their problem. And once I got rid of the migraines, I noticed that the tremors went away.
Yeah, right.
And this is what got me on this trek of reading about how migraines are related to at least 75 neurological disorders, including dementia, autism, Tourette's.
Well, I can see how.
And so we do his procedure. It's an outpatient procedure. It takes me about an hour. It's done under general anesthesia. Yeah. And he said it was
pain-free.
Pain-free?
Oh, yes.
Okay. Pain-free it is.
Pain-free it was.
And so you go on, you're taking your antibiotics, your steroids, and what did you notice during that first week or two of recovery?
No tremors.
No tremors. Now, this is kind of amazing. And I told Harold at that time, you know, we had him on steroids. He already had anesthesia, and maybe it was an effect of either the steroids or the pain medicine, but we watched that, and he's been documenting all his symptoms since then.
Yeah, right.
And it's been, what, 3 months?
Yeah, about 3 months.
About 3 months. Okay. So you noticed no tremor.
Yeah, I noticed no tremor.
You actually said you forgot you even had Parkinson's.
Yeah, I was feeling so well. I immediately began to recover because I was getting oxygen. my cells began to duplicate in a healthy way as opposed to starving for oxygen.
Yes.
So I noticed that my endurance improved. It's still improving.
Let's talk about that, because you're a member of this boxing club for Parkinson's patients, right? Let's talk about how you were before, how you are now.
Well, the Rock Steady Boxing here in the Woodlands, Texas, is a class that I attend twice a week, and it's drilling through boxing exercises, yoga, and strenuous movement exercises. You know, that really challenge your immune system and your core, if you will. So we do. So before I had the surgery done, I noticed that during my exercise routines, we have coaches that coach us. I would have to stop and breathe.
Okay.
I couldn't endure.
Mm-hmm.
And so I would have to stop them from the procedure because we're not boxing each other.
Right.
We're boxing bags and
Right.
the cuffs and whatnot. So I would have to stop and say, okay, I gotta catch my breath. So breathe. And she's explaining, breathe in through your nose, out through your mouth, and because you're professionals, do a wonderful job with this. So I'm breathing in through my nose and out through my mouth, but I'm missing time building my endurance because I'm standing there.
And how long would you have to stop?
30 seconds.
Okay.
So because I'm trying to keep my endurance up.
Yes.
Build up and be stronger.
And now since your procedure?
Yeah, and then since the procedure, I don't have to stop anymore.
You don't have to stop at all?
Occasionally I do because I'm fighting harder now.
You're performing better.
Oh, yes.
And there's a reason for that. And we'll talk about all your other symptoms too. But since you talked about breathing better, it's important to know that in the nose and sinuses is made this molecule or gas called nitric oxide.
Yes, right.
And nitric oxide in a normal nose will get inhaled and go into the lungs, where it dilates vessels, but it also then gets into the bloodstream and dilates the blood vessels there. So what you're doing is you're benefiting from that vasodilation, getting more oxygen to your organs, to your brain, to your muscles.
I noticed that my blood pressure dropped.
I looked at your chart today. When you first came into my office, your blood pressure was 160/90.
Yeah.
And then the last time you came in, it was like 120 over.
Just yesterday, it was a 111/70.
Look at that.
Yeah.
So these are all these are all great things. So now we know you're breathing better.
Yeah.
Your endurance is longer. Your sleep. Let's talk about your sleep.
No more CPAP.
No more CPAP. So here is another point I'd like to make. He had sleep apnea and loud snoring. Again, as a proponent of looking for the root cause of things, it's very important to look at the nose and the throat and make sure those areas are normal before you put a mask on somebody. And I can say that you probably didn't have that done. Otherwise, I wouldn't have found what I found on the scan.
Right.
So here he was, perfect example where a mask was placed on his nose, but his nose was not open.
Right.
That makes tolerating the mask very, very difficult because some people explain that they feel like they're suffocating. Some people say they knock the mask off during the middle of the night. They can't keep it on. It's uncomfortable. And you resort to not using it. Were you using your mask?
I was required to.
Yes.
Working for the school district, driving a school bus.
Oh, you were required to.
Yeah, I was required to by my health requirements.
Well, this is very important. Here you are driving a bus, carrying school kids. Right. You have to be at your very best.
Absolutely.
Without the mask, you're going to be tired, fatigued. You're going to have chronic sleep deprivation. Which means you run the risk of falling asleep while you're driving.
Right.
And it happens, unfortunately, across this country a lot. With truck drivers and bus drivers and people who do that primarily. So yeah, very good point made there. So now, since your surgery, where I corrected and I normalized your nose and I normalized your throat by clipping your uvula.
Right.
Tell us how you're sleeping.
Well, when I was being diagnosed with sleep apnea, one of the tests that the doctors would give me was to relax, breathe in through your nostrils, and they would push my chin back, and it would shut off the airflow. I can't even make that do that now. So now I get air regardless of where my chin is, because in the night, if you're sleeping and you're laying on your pillow and your jaw relaxes and drops back, your air is shut off.
Yes.
and then you wake up in a scare because your body goes into shock.
Yes.
Where's the oxygen?
Exactly.
And then you start all over again. So I was sleeping, 15 minutes at a time.
No, Harold,
Yeah,
wait,
and
Harold.
then waking up. Yeah.
15 minutes at a time, and you're waking up because you're feeling like you're choking. So this is going all throughout the night?
Yes, all through the night.
Was this with the mask on?
With the mask.
No, I didn't know that.
Yeah.
So you really weren't getting any good sleep. You're getting the best sleep you could given the circumstances.
Yeah.
But now, how are you sleeping now?
No CPAP.
No CPAP necessary.
I can sleep in any position.
Yes.
My chin does not interfere anymore at all. And I have nice livid dreams, and I go places and I wake,
So you're getting deep sleep now, REM sleep now. You're dreaming.
Right. No, I go places and see friends that I hadn't seen in years.
And you sleep how long continuously?
I wake up in the night to use the restroom once.
Okay.
I get probably 4.5 hours up front, and then go to the restroom and go back and get another 4.5. It's not uncommon for me on a day off. I get 10 hours.
10 hours. And you hadn't done that in a decade, you told me.
Oh, no, more than a decade.
More than a decade.
I drove a bus for 20-something years.
So here you were, and I like to describe this as, here's somebody who was getting chronic sleep deprivation, wasn't living his best life. This is about a prescription for a good life. So here we are talking about this, and I want you to listen closely because Harold was not living. In fact, Harold, you were slowly dying.
Yeah, oh, I could feel it. And I believe that's part of what brought on the Parkinson's.
Okay.
Because my system had just dropped to a point where it wasn't sustaining itself anymore. I couldn't fight off. Now, I still have Parkinson's.
Yeah.
I guess.
You guess, right.
Yes.
It's only been 3 months.
No,
we don't know.
I'm very optimistic. I believe in the ability to become what you think you are. If you think you're sick, you will be sick.
Yes.
If you think you're healing, then you can be healing.
Yes.
Your DNA, from what I understand from what health programs I've watched on the Gaia Network, different doctors, Dr. Dispenza, for example, talking about how you reprogram your DNA all the time. So if you think positively, then you will live a positive life. If you think negative thoughts, then your body will live a negative life.
And somewhere along there, you need some assistance from somebody like Dr. Kevin Smith, who knows what he's doing to optimize these anatomical abnormalities and make your nose and throat normal. I want to get back to that because, okay, we've mentioned several things. So your blood pressure's better.
Yeah.
You're sleeping better.
Yes.
You're not snoring.
No.
You don't need the CPAP mask.
No.
I think you had trouble with your ears. We did balloon dilation of your eustachian tubes. How your ears doing?
You're fine.
Good.
My one thing I had noticed is that my nose, before I had your procedure done, my nose ran constantly.
I saw that. Yes.
For decades.
For decades. And the reason that was, he had this horrible deviated septum. It was irritating the nasal mucosa. It was producing a little more mucus than it should have. And instead of you just breathing normally with the mucus would then go back to the throat and you swallow it, it builds up and then it has more drainage. And so you had that for decades?
Not to mention what's going on in your stomach.
Right? That's right. So that's cleared up. No more runny nose, postnasal drainage.
I would have regular sinus infections throughout
the
year.
And we did balloon sinuplasty on your sinuses.
No more problems with that at all. One thing that was, and I mentioned to you before, is I would go to my regular physician and talk about pressures in my eyes. I felt like I had infections behind my eyeballs. So after your procedure, that went away.
That went away.
And my eyes actually retracted back into my skull, back to their normal
position. Back to their normal position. They felt like there was pressure. So
I
that's gone.
I think I'm prettier now.
Yeah. Well, you've always been a handsome guy. He's a musician. Yep. But, and then I sent you to the dentist because you had some poor dentition.
And
I knew that was causing inflammation in your body as well.
I had a flooring business, and I took on the school job for the insurance so I could get my teeth fixed. So I lived for decades with my teeth degrading because the insurance wasn't capable of paying the cost of having dental work done.
Yes.
So I was getting patched up and patched up and patched up. And so this went on for close to 30 years.
Oh, my.
Well, you saw my teeth.
I did.
And because you were in there cutting away and fixing my throat.
Yep.
And, at one point you approached me, you said, your teeth, pretty, you need to get something done about the tooth.
Yep.
So I had mentioned to you that story about, took the school job to get the teeth fixed, but never manifested because the insurance just couldn't afford it. So you introduced me to somebody. You said, wait a minute, let me make a call.
Make a call.
I wasn't expecting anything.
Now I'm intervening. See, again, a prescription for life.
So
the bond that we had.
So you called me and gave me a number and said, call this gentleman. And I called the dentist. He had me come in, and he did the examination and went to work on me immediately.
Pulled your teeth, got your dentures.
Pulled all the rotten
Give the
teeth.
folks a good big smile there, Harold. Show them those beautiful pearly whites that Dr. Lathey took care of and did for you. He's out here in the Woodlands as well. So if you need your teeth taken care of, he is awesome. They
treat me like family.
They do. And just like we treat you. That's why I sent you there. Dr. Lathey.
Yeah, you're more.
Woodlands Prosthodontics. I'm more than what? Go ahead, Harold. Now let's get into this life stuff now.
All right. It's been an experience with you that I've never experienced with a doctor before. There was always a barrier between me seeing the doctor and my ailment, and the office staff and the procedure that they would do, which I appreciated, but it wasn't connecting like we did. You had a genuine care that reached out, and I could feel the love, if you will, in a good way.
Yeah.
And I was attracted to that because I was so desperate for help.
And I was attracted to that as well. That's what I'm saying. It was a special bond. It really was from the moment we met, because I'm going to tell you, you got me when I stepped out of the car and I said, I don't know if this is going to bother you or approaching you this way. And you go, oh, no. He said, I send out goodness to the world all the time. And I just knew it was goodness coming back to me. And when you said that, I went, oh, I'm dealing with a special person here. Yeah. And so the moment you said that, it kind of made me realize that you're special and I'm a healer.
Yeah.
And I want to reach out to as many people and help as many people as I can, because I want people to live their very best life. Now, I didn't know you had all these other issues going on, but you had a lot of stuff, Harold, that's perfect for this show, because, again, the show is about instructing people on how to identify these areas that they can improve upon, get improvement, so that they can live their very best life. So let me just make clear that a deviated septum was actually a part of what Harold has and a part of what a lot of people have. There are some specific abnormalities in the nose that I know to look for, and it has to be corrected with my specialized technique. It's not just a septoplasty that ENTs do, but it's actually my Smith sinus migraine technique that achieves the results that Harold has and that other people have in getting rid of their headaches, their migraines, and sleep apnea, and all these other things. Because I've also had patients with 2 and 3 prior sinus surgeries and septoplasties who still have problems, who do well after I perform my Smith sinus migraine technique. So just wanted to make sure that that was clear.
What I noticed is that breathing better has the ability to feed my cells in my body with the oxygen, or the fuel, if you will, that is required to let them do the job they need to do. Because like you said, I was slowly dying, and I could feel it. My body was telling me something was going on, and I would see my regular physician and complain about the way I feel ill, I feel sick. She'd check me out and say, well, nothing's wrong with you. Well, I'm not well.
Yeah.
What's going on? What about my eyes? Your eyes are fine. Go to your eye doctor and get an exam. She'd say, yeah, well, you got a little glaucoma going on in one eye. We got it under control. But the pressures are always high.
I see.
Since the surgery, the pressures are back to normal.
Now, see, you're educating me now.
Yeah.
We're going back to nasal airway obstruction, inability to breathe, all the symptoms that it causes.
It's all right.
Pressure in the eyes, pressure in the sinuses, sinus infections, snoring, sleep apnea, postnasal drainage, which was chronic for you. And a lot of times people out here who are listening to us, you don't realize that the nose plays a big part in quality of life.
Oh, it's the intake manifold to the engine.
There you go. I like that analogy. And it really is. If you don't breathe well, you can't take advantage of the nitric oxide. And matter of fact, they say people who are chronic mouth breathers who don't breathe well through their nose have a higher incidence and a higher risk of heart attack and stroke because you don't have that benefit from having that vasodilation or dilation of the blood vessels to allow more oxygen and blood flow to get to those
the heart
organs.
has to pump harder to move the oxygen through the body because the body, the brain is telling the body, I'm starving.
I need more.
Right.
That's right. And all the other organs need more.
And it can cause an enlarged heart.
Enlarged heart, it can cause arrhythmias. It can cause, in the very end, you know what it causes? It causes sudden death.
Yeah.
The body can no longer go any longer under that type of stress. So I think at this point, I would like to, I've always wanted to start this and talk about and I think we'll be good at this. I'll tell you what is the meaning of life? And the older I've gotten, Harold, my interpretation of the meaning of life is this for me: connecting with people, sharing positivity, goodness, and love to them.
Absolutely.
So that they then will go out and share it with others. And I imagine a ripple. When you drop a pebble in a still water, you see the ripples just spreading. And I see this connecting, spreading goodness and love, and them doing the same as a ripple effect that then perpetuates and goes on forever. That's what I see.
It's the resonance of the string. Once you pluck the string on the instrument, it resonates, and the harmonics are part of it too. Something you don't see, that you don't necessarily hear, but there is a ripple effect that goes out into the universe.
There is.
I know, and it attracted me to you and you to me.
Yes, because we were on the same wavelength. We had the same energy. We're looking for the same thing.
Well, I was out praying about it.
You were.
I would walk the streets at night to be alone and have some solitude and talk to the universe.
Yes. And here I came.
And ask for help. And so it truly works.
It really did. It fed me because I'm a healer. It fed me to be able to help you.
Well, it reached you.
It did.
We are on that same frequency, but we all are. The music spectrum is full of frequencies. It's not just one note.
Yes.
All the frequencies of beyond what a keyboard can actually even hear. So just people need to understand that we need to share the love with one another.
We do. It's so, you know what it is for me? It's so fulfilling. I'm very fortunate that I'm doing what I was meant to do, my purpose and my passion in life.
It is the purpose of life.
And it's easy for me. And when I saw you, it just resonated with that. And the rest is history. Now, not everybody will receive my approach that way.
Got to be on that same frequency.
But I do my best, and I don't rule people out. As far as I can, I'd like to touch people, inspire people, so that people can live their very best life. And
not everybody's going to be receptive. So we deal with that. But there are channels to get to them as well.
Channels like this.
Yeah. Well, you may help somebody who they may help, who will send them to you.
Yes.
I advocate for you all the time. Everywhere I go, I'm telling, because people notice it in me.
Yes.
They go, whoa, the teeth, you don't have missing teeth anymore.
Right.
What's going on with the teeth? Well, let me tell you the story, and then I tell them the story, and it leads back to the deviated septum, and then the boxing classes and the Parkinson's. And
how's your tremor, by the way?
It's greatly reduced.
It's greatly reduced.
Yes, it is greatly reduced.
Well, we just have to give it more time and see what happens with that and what happens with the Parkinson's. That's the only way we're going to find out. That's crazy.
I used to
hold your hands out in front of the camera.
I used to shake violently all day long.
You did. And now, look at you. You're more still than I am.
Yeah. Well, I have what they call resting tremors.
Yes.
So while I'm resting, I might shake a little bit.
I see.
Like I do now. Mornings are almost non-existent.
I see.
I wake up from a restful sleep, and my body has its most energy. So I walk out into the yard with my bare feet in a ground, and then I walk back into the house and have a little glass of juice.
Yes.
And I play my guitar a little bit, and I relax and appreciate the healing that's taking place.
Yes.
I am aware of it.
You're embracing it.
As opposed to the dire need for help. I used to just feel desperate for some place to turn to. So my primary care physicians. God bless them. They're doing a fine job. But there's just not that connection that happens. There's a lot of healing that goes on in your relationship with your doctor.
There is.
There can be, but not always.
Yes.
So if the doctor is missing it with their patient, then that's a big part of the healing that takes place.
So would you advise people to find a doctor that they can resonate with?
They need to find Dr. Kevin Smith.
Well, thank you so much.
The healing starts when I walk into your office.
Yes.
Because through your staff, everybody treats me like a member of the family.
You are.
Well, I feel it.
You feel it, don't you?
I know. We share the last names, and I'm glad.
That's right. My long lost cousin that I found, right? Let's wrap this up. And what are you going to tell people out there who have Parkinson's? Let me just say, for a matter of fact, I want any Parkinson's patient or anybody with any neurological disorder to come to my office. We do free screenings to see if you have the abnormalities that Harold had that I can fix that may help either halt the progression of your problem,
right,
or who knows what it does beyond that. I can't claim it until I do it, but I'm offering that, and I offered it to you. So what would you say to people out there?
I will continue to advocate for you because it was something that I could feel immediately. And so the healing is continuing because this is relatively new.
It is.
So I will continue to heal and report to you my recovery process.
And we'll have you back.
Oh, yeah, you can't keep me away.
All right.
I will do what I can to send people to.
Well, thank you very much. And I appreciate you coming on, clearing the air, because we had a lot of air to clear today, and I think we did a great job. Thank you so much for being a part of this.
Oh, thank you for inviting me.
And join us next week on another episode of Clearing the Air,
There you go.
Your Prescription for Life. That's it for today. Until next time, stay curious, stay healthy, and keep shining. Don't miss out on our next episode of Clearing the Air, A Prescription for Life, packed with more conversations that matter. Be sure to subscribe and share with those you love.